Greetings from Bilmed Ultrasound Training Institute. Myself, Dr. A.B. Vani. I am Director CEO of Bilmed Ultrasound Training Institute. Today, we will discuss about ultrasound. What is an ultrasound? Ultrasound is nothing but a sound. Property-wise, both are same. So, when we will be defining the sound, automatically we are defining the ultrasound also. Now, what a sound is or ultrasound is? Ultrasound is a mechanical longitudinal wave. So this is the definition of ultrasound and sound also. So ultrasound and sound both are property wise same. Only difference is the frequency. In sound we are having low frequency, which we will discuss later on, and in ultrasound we are having a high frequency, but property wise both are same. So this is the graphical representation of a sound or an ultrasound. Now, how does an ultrasound works? So we will now in detail discuss about how the ultrasound is working. In a medical imaging technology, we are using high frequency sound waves and their echoes. We are using sound waves and they're bouncing back from the target, that will be echo. So we are using whatever we are sending and we are using whatever we are reflecting or getting back or bouncing back, that will be echoes. Now this technique is called as pulse echo technique. So whatever we are sending in the body, that is pulse, and whatever we are receiving back is the echo. So is the definition. The technique is known as the pulse echo technique. Now the same technique, this pulse echo technique, is used by bats, dolphins and whales. What for? To navigate in the medium. When a bat is flying, he is not seeing by his eyes, but he is navigating in the space by this ultrasound. By this ultrasound and by this pulse echo technique, a bat is making an image of what is there in the surroundings. And same is true for these dolphins and these whales also. They are sending the ultrasound wave, and when the ultrasound wave is hitting the target, in this given case a small fish which is at miles away from the dolphin or this whale, from this target, from this small fish, bouncing backs are the waves, and the whale is pinpointing from kilometers without seeing by using this pulse echo technique. And same pulse echo technique is used by the ultrasound machine also. Now by humans, this pulse echo technique, this ultrasound was first introduced in World War II. What for? To locate the drowned submarines deep in the ocean. It was next to impossible to locate a drowned submarine in deep oceans without using this technique. They sent the ultrasound wave, and when the ultrasound wave is hitting a metal, it will bounce back from this metal. And if there is a ship over here, a drowned submarine in given case, it will bounce back from this particular point, not from here, not from here, and not from there. So they calculated the time when they sent and when they received. That way sending and receiving will lead to a lag, and the lag will be calculated how much is the target away from my point. Number one. Number second, they will calculate when we have sent and when we have received. That way they will calculate, they will pinpoint the target where our drowned submarine is. So using this pulse echo technique, we located the drowned submarines in World War II. This is way back the medical ultrasound was introduced. After this, many years, we use this ultrasound for the medical purposes. Now, there are category of sounds. We are having infrasounds where the frequency is very low, and how much? Below 20 hertz. the frequency is 20 Hz and low will be labeled as infrasound. And what is audible to us is the audible sound where the frequency is ranging between 20 to 20,000 Hz. So we are able to hear to the sound when the frequency of the sound is in between 20 to 20,000 Hz. And if the frequency is below 20, we are not able to hear, and that way the sound will be infrasound, which we are not able to hear. Now, there is something which is above 20,000 Hz, and whatever above 20,000 Hz will be an ultrasound. So ultrasound is having a frequency of more than 20,000 Hz. This ultrasound I cannot hear because that is not in the audible range. Now, ultrasound is anything which is above 20,000 Hz, but in medical diagnosis, in medical diagnostic ultrasound, we are not using just about 20,000 Hz, but 1 megahertz. Mega means million. It means in medical diagnostic ultrasound, the frequency of the wave is more than 1 million Hertz. Now, there are different kinds of ultrasounds. What types of ultrasound we do have? We are having 2D ultrasound. Now, in 2D ultrasound, the image will be, we call it grayscale also, the image will be black and white. The black and white picture, whenever there is 2D ultrasound. Then we are having 3D ultrasound. In 3D, it is a third dimension which is added on to this 2D ultrasound. That will be 3D ultrasound. And in 4D ultrasound, we are seeing any object in live. So whenever we are seeing a live, that will be 4D ultrasound. So lastly, we are having Doppler ultrasound. In Doppler ultrasound, we are seeing or we are scanning anything which is in motion. And here we are scanning the blood. We are scanning the vessels. So for vessels is the Doppler ultrasound. Now, USG applications. We are scanning the uterus, ovaries. So female urogenital system is the field where we are using this ultrasound. In abdominal ultrasound, we are scanning for gallbladder, liver, pancreas, spleen. So that will be abdominal ultrasound. Then we are having a KUB. In KUB, we are scanning kidneys, ureter, and bladder. So then we do have ultrasound of pancreas, and we do have a superficial ultrasound also, that is the thyroid, scrotum, or breast. And of course, the internal organs, for example, the spleen, liver, etc., is also used to scan. We are using this ultrasound to scan these organs as well. Now, there are many probes. These are some of the probes which we are using in this diagnostic ultrasound. So we do have TDS ultrasound probe, we do have a convex probe, we do have a volume probe, and we do have a concave probe. The basic, the property wise, how they are different, the difference is in frequency. So this was all about the ultrasound, the different types of ultrasounds, the applications of ultrasound. Thank you very much.